Everybody's buzzing about AI, and most of it, 90% of it's just hype. What are your thoughts in terms of engagement? What's the role? Where will it take us?
The first thing to say is that the potential here, I think, is limitless, right? I think the idea that AI is overhyped, right? Maybe it's overhyped at this point where its capabilities are where it's are, but I think kind of near term, 2, 3, 4, 5 years, the potential is so vast that it's really actually quite difficult to kind of appreciate where it's going to go. I think what we can say, for the purpose of this conversation, that I know we've got GDPR, and that kind of so the knowledge you have of an individual is limited to first-party cookies, but the information that you can get from an individual, and then across different sort of segments to start building in kind of predictions, to understanding that user, to personalizing it, is huge, right? And whether we look at that at a commercial setting or a health and digital health setting, where ultimately we want to improve someone's health and we want to do it in the right way, and do it in a way, like I mentioned before, with the idea of humane design, is the idea is not to kind of capture an individual and keep them engaged with your assets for as long as possible, right? But ultimately, with and through AI, we can make experiences more relevant, more personal, more useful and valuable to an individual, right? I guess the question comes as to what's the limit, and how human will kind of the touch be required? How much will people need to feel that kind of that human connection? And I think one of the things, and we've talked about this as well, Steve, loneliness, right, is as more people kind of engage online and enjoy physical connections less and less, is that you have to kind of place that back into the mix, right? It has to be part of the mix, is that you don't produce something digital that is just purely digital and that's you're good to go. It's going to be about how you connect people back to each other as well, but do it in a way that is efficient and scalable. We know that reduce the number of healthcare professionals, the potential for AI to kind of fill the gap, to improve healthcare access, improve how things are done, is huge. And I realize at this point I need to hand over because I probably carry on rambling here.
I actually think the opportunity as well. I might add a few caveats. So for me, there is 3 different levels when we talk about engagement in AI, right? There is creating engagement through AI, which basically just means, right, like technically, if I give the AI every single healthcare app that exists, together with the data of how much people used it, it's gonna do a very good job of designing new experiences, right? Or of optimizing the experiences. So I think that's something that is really, really well done. If I think about it on a different level, in terms of, here comes the problem, and I don't know how we solve that, but here comes the problem, because what is engagement in healthcare, right? Engagement in healthcare is maybe, as we said before, it might not be the optimal metric. So I can actually say that AI is only as good as the data you feed it. But anything that we do in sort of these spaces, right? I mean, let's not say physician education, because that's actually okay. But let's talk about what Bryan mentioned in terms of behavior change for patients, right? Engagement is not your optimal metric, it's the health outcomes. I doubt that anyone creates a database of how patients engage, collects their medical data long-term, and then is able to use AI to link that back, right? If you do that, that's fundamentally, that's groundbreaking, right? Nobody does that. So there's a huge danger that you start using AI in order to increase the engagement in an app, which is not actually good for anyone, because it does lead to endless scrolling, binge consuming of content that maybe you shouldn't, right? I mean, we know that AI, that fear is more engaging than anything else. So actually instilling fear in the patient is probably the best thing that the AI would then try to get to. So that's that part. And then there's the last part of just like using it in terms of creating engagement. When we talk about the LLMs, I think there is a huge potential here as a sort of engagement mechanism, what we said before, right? Recreating that physical experience to some extent, because there is simply, at the moment, nobody better to, at a vast scale, have conversations that feel sort of natural, right? And that's what will drive engagement. If there is a person or not, I think there is something that you can leverage within solutions and within that engagement piece, that just makes just a huge potential for AI in the short term, right? Because that's where, once you do it safely, can be done. But I think sort of the three high level things that I see AI doing in engagement, with varying degrees of risk.
Yeah, definitely some of what you both have said resonates. I do think that it's important to acknowledge that like AI and healthcare is not a new topic, but generative AI this year becoming so widespread has changed the way that people engage with data and the way that stuff can be interacted with in a new way. I think like AI in the diagnostic space, for example, has been in the works for many years, and AI in the drug discovery space is also something that's not new. But I do think that AI and generative AI, there's a lot of conversations about how it's taking a less human approach to how healthcare is actually delivered. And I think it's the responsibility of everyone who is actually creating these solutions to make sure that we're leveraging AI and generative AI so that it's actually driving more human-centric components into the way that healthcare is delivered and the way that people are treated and the way that people engage with their health information and data and all of that. So I think that that's an important factor, because when you look at the way that AI is being used in the mental health space, or the way that it's being used in certain, I think a lot of the kind of chatbot space as well, we're still really early on, so people are not really feeling that that's going to be the most high impact. But I do think in the long term, it will drive much more kind of patient-centric care, even in the sense that if doctors have more free time to meet with their patients because their administrative work or their kind of treatment recommendations are faster or more automated, or their communication with their patients is much more streamlined. I do think as long as we're kind of aligned to that mission, then yeah, we can do something good. But I do think the topic of digital health, we always talk about behavior, and I think we're still trying to figure out how to best design the behavioral change that integrating AI and generative AI and all of our solutions will have. So I don't think we're there yet. I think we're staying adaptive into how much, or I guess I should say what will work, and what will create the composite health outcomes. But I think I'll keep my answer at that lens for now.